Dear students, this is Dr.Debasish Pradhan. We are going to have this lesson, that is anti-arrhythmic drugs and its pharmacology. So this is a very most important chapter for today's class, or today's the B Pharm, M Pharm pharmacology syllabus, as per this syllabus. So we are going to start this anti-arrhythmic drugs pharmacology. So basically, anti-arrhythmic, the term usually it derives from the rhythm and anti-arrhythm. That means these are the two things they join and they stands for the anti-arrhythmic. So anti-arrhythmic is the things they comes from the basic things like when the drugs they are used to treat the irregularities of the rhythm in the heart. So this is known as anti-arrhythmic drugs. So what are the types of rhythm? One we know, that is normal rhythm, that is 60 to 100 beats per minute, that is normal. And the first one, that is tachycardia or tachyrhythm, and the second one is bradycardia or the bradyrhythm. So we can see this is normal, that is 60 to 100 beats per minute. Bradyarrhythmia, that represents less than 60 beats per minute. Tachyarrhythmia, which represents it is more than 100 beats per minute. Again, one is atrial fibrillations, that shows like it is more than 300 beats per minute, which is more severe, or which has a more severity in heart problem. That shows 300, that is atrial fibrillations, more than 300 beats per minute. So this rhythm or the anti-arrhythmic things, they results into various disorders. That is, the first one is abnormal induction by the SA node, and the impaired conduction of impulse. So first one is abnormal induction of impulse, that is raised by this SA node, which is a pacemaker, which shows the pacemaker activity by the SA node. It is also known as the automaticity. That one is the abnormal induction of SA node. And the second one is impaired conductions. That means after impulse generations, the AV node has the role to propagate it throughout the Purkinje fibers, and when it gets impaired, that is due to the result of this bradycardia or the tachycardia. So there are four basic mechanisms which results into this bradycardia or bradyrhythm or tachyarrhythmias. So, these antiarrhythmic mechanisms are, the first one is the abnormal pacemaker activity, which is known as ectopic activities. So, first one is the ectopic activity. The second one is the re-entry, and fourth one is the heart block. Or the impaired fractionation of impulse. So, here we see these are the four mechanisms. These are the four mechanisms, which are, one is the abnormal pacemaker activity, which is known as ectopic. The second one is the abnormal depolarizations, or we can say this is the delayed depolarizations. And the third one is the re-entry, and the fourth one is the heart block or the impaired fractionation of impulses. So, in the ectopic pacemaker activity, the pacemaker arises from this SA node. SA node, that creates the impulse, that propagates, they generate the impulse, and this SA node defunct or the abnormalities happens due to several factors, like myocardial infections must be there, or any drugs we are using day-to-day life. They tend to generate some impaired conductions. And the third one is the actions release of catecholamines. That means the adrenaline. These are the catecholamines. They have the greater role or greater possibilities to impair this generation of impulse by the SA nodes. So, this one is the abnormal induction of SA node, generation of impulse by the SA node, and they have these four type of characters or the mechanisms. And the second one is the impaired conductions. So, this is generally they are taken up by this AB node and they propagate the impulse to the whole chamber or the muscular fibers. So, here this ectopic arises due to these factors. One is myocardial, that there might be a sympathetic activity, increased sympathetic activity, or this myocardial infections which may be result into the pain, or the fractionation of depolarizations. So, these are the things. The second one is the abnormal depolarizations. So, abnormal depolarizations or after depolarizations, they are generally divided into two types. I have represented two graphs, that is early after depolarizations, and the second one is the delayed after depolarizations. Early after depolarization and delayed after depolarizations exist, like we know the action potentials, we know the generation of impulse. From the generation of impulse, then sodium has the role to create a environment of positively cationic cells. So, here after this zero phase or the depolarizations, you see this graph very minutely, this early after depolarization. That means after the depolarizations, you see it should be like it should be like this. Here, due to this abnormal or the impaired conduction of impulse propagated by the AV nodes, here you can see this graph does not exist, and it is showing the after depolarizations a quick rapid movement of ions, which represents this graph. That means there are somewhere we are lacking the calcium ions representations or the potassium ions representation, which makes corrections to the depolarizations after 0.1 or 0.2 milliseconds. Here you can see this depolarization happens, only depolarization happens, and thereafter no. So, it may be due to bradycardia, which results in the bradycardia. This is known as early after depolarizations. And the second one is delayed after depolarizations. That means the peak, here you can see the peak and the gap of the things are very much similar and very much in a way. Here you will not find any graphical representations where the calcium ions or the potassium ions they represent their representations as a whole. So, here you see after depolarizations or the zero phase, you see there are delayed after depolarizations, which results in tachycardia. You see one or mostly two movement of things will be there and no complete cycle will be there. So, which represents the delayed after depolarizations. The third one, heart block or the impaired fractionation of impulse. Sorry, the third one is the re-entry. So, re-entry is a kind of thing where the movement of ions or the movement of cations or the movement of flow into a particular area is like within the cycle it represents more than 2 times or 3 times. So, here I can show you a movement starts from there, then the cycle goes on like this. A cycle goes on like this. If a AV conduction blocks over there or any myocardial infection or the any ischemia kind of thing happens over the cell wall, there a conduction or the blockage of a kind of thing or ischemia kind of thing happens over there, then the propagations of those impulses, it will rotate over like this, because they cannot cycle the things in a single moment. So, the impulse again and again they will move over there. So, that represents or that shows impaired conduction or the blockage of things. So, which results into re-entry. The fourth one is that is heart block or the impaired fractionation of impulse. So, heart block or the impaired fractionation of impulse, they are the fractionation of impulse which represents the rising of the fractionation of impulse from the beginning of the fractionation of impulse from the minus 70 millivolt, which is a threshold potential, from that point of view till the complete conduction of the cycle, it represents 0.2 to 0.4 milliseconds. A rhythm from the starting point of view to the end, it took at least 0.4 milliseconds. Here, so heart block implies this non-performance of S node, non-performance of the AV node, and the conduction stops over there, propagation stops over there. So, which results into this dysrhythmia or the anti-arrhythmic or the dysrhythmic things. So, here after this rhythm or the mechanism of drugs, we will find, we will go for this anti-arrhythmic drugs. Yeah. So, looking at the performance of the potassium channel, looking at the performance of the calcium channel, looking at the performance of the sodium channel, which is the voltage gated calcium channel, voltage gated ion channels, we have 3 or 4 categories of drugs. So, basically first one is the membrane stabilizing agent drugs, which represents again 3 types, 1A, 1B and 1C, class 1A drug, class 1B drug and class 1C drugs. So, basically class 1 that shows membrane stabilizing agent, where sodium channel blockers can be administered. So, sodium channel blockers can be like class 1A drug, that is quinidine, class 2A drug, class 1B drugs, that is lidocaine, class 1C drugs, that is flecainamide. So, these are the membrane stabilizing agents which are essential to make propagations, to make conductions or to make a well recognition impulse conductions. So, these sodium channel blockers are important drugs as far as the antiarrhythmic drugs are concerned. And the second points are the calcium channel blockers. So, calcium channel blockers are the verapamil, leltazem. These are the essential drugs to correct the antiarrhythmia. So, we can administer this calcium channel blockers as well. Third one is the potassium channel blockers. So, potassium channel blockers are the amiodarone. These are the drugs which tends to block the potassium for this efflux actions. So, we can see after administration of the potassium channel or the amiodarone kind of drugs, we can protect the efflux of the ions from the inside to the outside cell, and we can correct the arrhythmia. The next one is the most important thing, that is beta blocker. So, mostly day to day life, when you go to the doctor, they will find the blood pressure measurement, and they will prescribe you the beta blockers without seeing the other parameters like the blood flow, the ECG, the other things. So, they are just prescribing you the beta blockers, the propranolol, the atenolol kind of things. They will administer you and they will make it correct your this arrhythmia or the blood pressure, rising of blood pressures. So, these are the 4 categories of the drugs. The first one is the membrane stabilizing agent, which correct the sodium channel blockers. They block the sodium channel and they correct the arrhythmia. Second one is the calcium channel blockers. They block the calcium influx, and the potassium channel blockers, they block the potassium influx, outflux or efflux, and the fourth one is the beta blockers, which they act on the beta receptors. So, with this, I am concluding the session, that is anti-arrhythmia drugs and their pharmacology. Thank you guys.